today we're going to talk about how to measure lumbar extension with a goniometer. Contraindications to measuring lumbar extension for your patient are if the patient has pain, numbness, or tingling during lumbar extension. You can go ahead and measure lumbar extension if you see that the patient has decreased range of motion, if they have weakness during lumbar extension, and you want to make sure that when they're performing the lumbar extension they don't have any pain. As mentioned by Norkin and White, it is important to keep in mind that all inter-tester reliability and validity for all goniometer measurements are poor. Keeping that in mind, it is important to get a goniometric measurement of your patient's range of motion in order to have a baseline to compare to as your treatment progresses and to see how your patient is improving.
There are 5 lumbar vertebrae, as seen here, and in general, the lumbar region of the back is very stable. There are many strong joint capsules that surround each of the 5 vertebrae, and in addition, there are strong ligaments that run on both the side, the front, and the back that add to make this a very stable area of your body. The upper portion of the lumbar spine is usually more stable due to some weaker ligaments in the 2 lower vertebrae of the lumbar spine. So here you can see the 5 lumbar vertebrae, L1, L2, L3, L4, and L5. These lumbar vertebrae as a whole are going to act to facilitate flexion and extension while limiting side bending and rotation. Now when they move, what's going to happen is there's going to be a superior vertebrae, in this case L1, that's going to tilt and slide back on this lower vertebrae, in this example L2. The inferior articular facets of the upper vertebrae, in this case L1, are going to slide down on the superior articular facets of the lower vertebrae, in this case L2. So as you extend, there's going to be stretching of the ligaments and muscles on the anterior side of the spine, in this case the anterior longitudinal ligaments, anterior fibers of the disc and joint capsule, as well as abdominal muscles. And there could also be some bone-on-bone contact between the facets themselves and maybe even spinous processes when you do that extension.
Okay, so for landmarks for your goniometer, you're going to want to start by palpating on skin. You're going to palpate the superior iliac crest, and then you're also going to palpate the anterior and posterior iliac spines to find the midline of the pelvis. And so your fulcrum is going to go at the junction of the superior iliac crest and the mid-axillary line, which is going to be about right here. And then your stationary arm is going to be along the midline of the pelvis. You want to keep it along the midline of the pelvis and not vertical to the floor, so you don't take into account hip motion when you're doing lumbar extension. And then your moving arm is going to be aligned along the mid-axillary line. So normal range of motion for lumbar extension should be 20 to 30 degrees, and the end feel can be either firm or hard, depending on what structures are limiting the motion, and those structures could be ligaments, bone, or muscle. Hi, Ina. My name is Nicole Harmon, and I'm going to be your physical therapist today.
Nice to meet you.
So today I just want to look at your back motion. So if you could stand up and take your shirt off for me.
Okay.
And just go ahead and stand right here, turn to the side. Alright, so I'm just going to feel for a few landmarks right now. Alright, and can I have you bend your back as far as you can? Alright, and then move forward. Was there any pain with that? Okay. Any tingling? Nothing? Okay. Could you bend back for me again? I'm going to stop you right there because I felt your pelvis start to move. And if you could hold this position, I'm just going to measure the joint angle. Alright, and I'm getting about 30 degrees. You can go ahead and stand up.